Well, hello, Chiropractic First Rockford family. Dr. Johnny Kirk here, and I'm here to share with you guys the newsletter that I wrote for this month. And if you're here in the clinic, you'll see that it's about reasons to get adjusted while pregnant. And this holds dear to me. I know there's a number of patients that I'm working on right now that are pregnant. They're either in their first trimester, they're in their second trimester. Some of them are almost due and ready to give birth to this amazing child. And when it comes to chiropractic care during pregnancy, there are numerous researches and benefits to being adjusted during pregnancy. And sometimes you might ask, like, why would a pregnant woman want to get adjusted during that time? Well, number one, research shows, if you read my newsletter, that it shortens the labor delivery time, right? I mean, what mom? I saw my sister go through delivery and it was a long process, but what mom wouldn't want to have the chance to shorten the labor process to allow more room for the baby during a normal birth, not a C-section, but a normal birth, and also help reduce the pain? Because that's the one thing that I noticed that the research also shows is chiropractic care allows pregnant patients to have reduced back pain, less low back pain, hip pain, headaches, you name it. But during the delivery process, a lot of times women might get an epidural, which is actually a nerve block placed at the very bottom of their spine, right? So if we look here, you would understand that here's the area of a nerve block, and the baby is sitting in this pelvic bowl right here. And so they literally take a needle and inject it into this area of the spine to basically block the sensation so that women don't even have any sense of what's going on during the birthing process. And not only do epidurals have adverse reactions, but what I have noticed is when mom is trying to recover after the birthing process, even a few weeks later, she still has a weakened discs. She still has a weakened part in her low back. Basically, this very lowest part is weakened, and it leads to having back pain even after the birth itself, which we're trying to make sure mama has the best experience and a nice healing recovery time with her beautiful bundle of joy. Now, the last thing that I'll mention is when it comes to chiropractic care during a pregnancy, it allows the possibility of a breached birth to decrease, right? We don't want baby's feet going first. We want baby's head to go down first. And so having different Webster techniques or different pelvic techniques, these help mom and the baby, which is more important. I mean, making sure that baby has enough room in the right space and does not need an emergency C-section so that they can have a normal birthing experience. It's not filled with pain or stress or the chances of even having the umbilical cord wrapped around the child's neck. I mean, all these things are reduced when there's regular chiropractic care, especially in the third trimester. When mom is almost about to give birth and her center of gravity is shifted forward and her pelvis is all out of alignment, obviously baby is going to have a tougher time in that position compared to a mom who has maybe a great adjustment, has more pelvic space, works on her round ligaments, and has that decrease in the long run too. So getting adjusted during a pregnancy and during that time, especially third trimester, is so vital for not only mom, but for the baby as well. So I hope you enjoyed the newsletter this month. If you have any questions, please bring it up to me. If you have any pregnant moms wondering, should I get adjusted, send them our way because we would love to help and serve them and their families. So I hope all of you have a great week, and I will see you here in the clinic soon.